Do you think you might be losing patients due to poor communication? What does that mean? Well, it means that patients may not be coming to your practice because they didn't get the type of communication that would make them feel that they should be coming to your practice, or they got no communication at all. Well, there's something else that's going on, and it's going on in a lot of our practices. It's what I call being quietly canceled. Now, what does quietly canceled mean? It means that people aren't coming to see us because they decided to cancel us, but they don't say anything. Most of us don't. If you look at your Google reviews, you have 5-star reviews, hopefully a lot of them, and then you may have like 1 or 2 1-star, but there are very few reviews that say 3 or 4 or 2. They're at the extremes. Most people will say something very positive, and then there's always that 1 or 2 people that will say something very negative. There are a lot more people that feel negatively about practices that just don't say anything at all. What do? They quietly walk away. It may be happening in your practice, it may not be. It may be happening in your life, and it may not be. We just don't know because we don't hear about it. It's interesting. When someone really likes your practice, they may tell a bunch of people about your practice. When someone really doesn't like it, most people just walk away. I know for me, I'm a big person that likes to go to restaurants. I'm a big foodie. I don't know if I'm a foodie or not, but I just like food like most everybody. And restaurants are a big part of my culture and sort of how I run our office, like a really good restaurant. So if I go to a restaurant and I don't like something, here's one of my pet peeves. One of my pet peeves is having to pay for something that I asked for that's a little extra that doesn't cost them very much. For example, I go to a restaurant and I'm ordering a hamburger. And then the hamburger comes and it's like $10. And I say, would you mind if I have a slice of tomato with that? And they go, no problem. And they put 50 cents on the bill. Now, it's not the 50 cents, but the fact that they charge me a little bit extra. Unless that hamburger is phenomenal, I probably won't go back to that restaurant. I quietly cancel that restaurant. Well, does that happen in dental practices? It certainly does. Maybe if you give an injection that hurts a bit, or you're not gentle, you don't put the topical on, or you don't answer a patient's question, or you rush out of the room. You go, is everything okay? And you're gone like that. That sometimes happens. I used to be like that early in my career. Early in my career, I was so busy. I was so impatient. I had to go so fast that I didn't take the extra time to ask a patient, is there anything else that you need? Are you sure? And I'll stand there and I'll make sure that patient, I will lock eyes, I look at them. I may even tap their shoulder gently, make some form of communication. I go, is everything okay? And then I'll wait for them to say, yes, it is. And then I will say, are you sure? Because I'm here now. They go, no, we're good. Thank you. And I walk out. That is important communication. Now, in our offices, one of the big communication tools is the telephone. Now, before a patient comes to our office, there are probably about 10 touch points before they meet the doctor. From looking up your phone number on the internet and looking at your website and to talking to somebody to driving to meeting the staff members. But the telephone's a pretty big deal. So the telephone, oftentimes for patients, is the first intimate communication with your practice. You want to give that patient a really good experience. Now, in my experience, I don't like to use the telephone to call other offices. I especially don't like to call medical offices because I get caught up in a phone tree, or it rings and rings and rings. I'm not a very patient person when it comes to the telephone, so I try not to make too many telephone calls. I only call people when I know they're going to be able to pick up. One of the things that I find most distasteful for me in the practice of dentistry is having to call another dental office. Why? Because I don't know if I'm going to get the person that I want to speak to. And it may be 5 or 6 minutes before I find out that they're not available. That also happens to our patients. So when a patient calls your office, how are they greeted? Is it picked up on the first or second ring? Or are they ringing and ringing? Or do you put music on? Or do you, my favorite is the infomercials. The last thing I want to do is have to be put on hold for 3 minutes and listen to the fact that this dental office is the best in the world and that they offer all these services and that there's a special coming up because it's the end of the year and I should use my insurance. I don't know who thought of these things, but what they want me to do when I start to hear these things is hang up the phone and never call that office again. If this is such a great office, they'd be talking to me right now and taking care of my needs. So here are a couple of pieces of advice that I'm going to give you all, if you're interested, on the telephone. Number one, have it be picked up by a human being on the first and second ring. Now, I don't know why human beings don't pick up the telephone anymore, but it's very hard to call anybody. In New York City, which is a big restaurant city, I love restaurants, there are 8,000 restaurants in New York, I say about half of them don't have a telephone that you can call. You got to go online, and what happens when you go online? It doesn't work, and you can't make the reservation. Then you got to call back again. It's sort of a negative connotation of making, your appointment. And that happens in a lot of dental offices. It doesn't pick up, and when it does pick up, you get to go into the phone tree. Now, I don't know who created the phone tree, but it was somebody who wanted to make sure that people don't buy. The phone tree is an anti-sales technique. Now, I know this one office I call, it happens to be an office of an ENT, and I call them, and I always go into a phone tree. I know the people very well. There are 2 doctors, and there are 7 staff members. Why do I need to go into a phone tree for 7 staff members? Click here if it's an insurance question. Click here if it's a prescription. Click here if you're a doctor. Click here if you're a patient of record. And then you click and you go, I'm sorry, the person can't answer right now. So phone trees are basically an anti-sales technique. So if you have a phone tree in your office, get rid of it. If you want to keep it, but I would rather hire another employee to pick up the telephone, because that is very important. They can develop a relationship with the patient. They can talk to the patient. They can give them a good experience. And then the patient may want to come and see you. So phone trees, don't do them. But I know a lot of people have them. Most people have them. But we, at this point in our office, we still have a human being answer the telephone. The other thing is, why don't you pick up your phone during lunch? Okay, when am I going to call the dental office? When I'm off. When am I off? Between 12 and 1 o'clock. I pick up the phone, I call, make an appointment. I want to get my wife in. I want to make an appointment for my family. I'm sorry, we're at lunch between 12 and 1. Please call back at 1 o'clock. I call back at 1:01. I'm sorry, we're at lunch between 12 and 1. But it's 1:01. I mean, it's again another anti-sales technique. Pick up the phone during lunch. It's the most important time to pick up the phone, because that's when patients are going to call you. Another thing, on hold. Don't keep people on hold more than 30 seconds. And if you're going to put them on hold, say, we're going to put you on a brief hold. It'll be no more than 30 seconds. When I'll call a doctor's office, I'll call Dr. Smith, not his real name. I'll call Dr. Smith and I go, can Dr. Smith get on the phone? And then it'll be, please hold. And then now I got to listen to an infomercial. And then they pick up again 2 minutes later. And they say, oh, who's this? I said, it's Dr. Sonic. Can I speak with Dr. Smith? Let me see if he can take the call. 3 minutes later, he comes back. He says, nope, can't take the call right now. What's a good time to call you back? Well, the good time to call me back is right this minute, because I'm on the phone. Now it's up to 5 minutes. Jose and I, my creative director, we've recorded these. I've never used them in any lectures, but the average wait time is about 4.5 to 5 minutes to be told that I can't speak to a doctor. I don't like that. Now, in our practice, when someone calls to speak with me, usually you can't get me. Why? Because I'm treating patients, and I don't leave the patient to pick up a phone call, because the patient is the most important person in my life when I'm treating that patient, unless it's an emergency. So if you want to speak with me, don't call me in the dental office. But if you do call me in the dental office, this is what's going to happen. Dr. Sonic is with the patient. Is this an emergency? No, yes. If it's an emergency, I'll try to get it, unless I'm doing surgery. Is the patient in your chair? Yes. Is it an emergency? And again, I'll try to get it if I can get away from the patient who I'm treating at that time, but I'm not going to leave the patient in the surgery. But what we will do is we'll say, Dr. Sonic is with the patient now. What's a good number to get you back? He goes, he would prefer to call you at the end of the day when you can pick up on your cell phone, because I don't want to be put into another phone tree. I don't want to wait for 4 or 5 minutes. None of us do. Our time is our most valuable asset. I don't care how wealthy you are, you can't buy time. It's the only thing that equalizes all of us. I don't want to spend my 5 minutes being frustrated, being put on hold. So if you can't take my call, or if I can't take your call, you'll be told within 30 seconds, he can't take your call right now. Is there a number he can reach you that's convenient after hours, that's easy to get to? Or how about text you, or how about email? Now, that takes me to the next topic, email and texting. I would prefer to talk to somebody, but it's not always possible to do that. I use texting only for basic things. I never have a conversation during text. I get into texting fights all the time. Well, actually, I don't. People try to start texting fights with me all the time. They go, did you see so-and-so? Did you see so-and-so? I don't know. I use text for this. I'm running late. I'm supposed to be there at 1:15. Dear Jose, sorry, running 5 minutes late. I'll be there at 1:20. That's the extent of my texting. Or if somebody needs a phone number, here's the phone number. I have a leak. Can you give me the name of your plumber? Here's the name of my plumber. Here's the phone number. I don't get into conversations during texting. Texting is a very poor way for me to communicate. Now, that may not sit well with some of you who are a little younger because you grew up with texting, but we did not. My generation did not. We grew up with rotary dial and talking one-on-one. That's all changed now. I accept that. I accept that there's text. I accept that there's social media. I accept that there's email. I have to. It's part of our culture. So what do I do with the text? Please text me a good time to call you and I'll call you at that phone number. I try to be clear and direct. Some people have oftentimes gotten into fights with me on text. They go, I heard this, this, and this, and there's be some misinformation in a text. And I'm not going to respond to that. I'm going to say, you know, I said, I'd rather talk about this in person or on a telephone. What's a good time to talk to you by telephone? Then another text comes back. I got a text yesterday from an 84-year-old man asking for a check for a very substantial amount of money to something he wasn't entitled in. Now, I don't know why I did it. Maybe because it was Sunday and I just wanted to have a little bit of fun. I texted back, I go, no, that's not a deal that you and I ever entered in. We have no contract and we never got into that deal. And he texts back, he goes, well, I think you would do this. And so I text back, I go, I didn't even enter that deal. I go, why are you doing this back to me? And he goes back and forth and I just look at this and then finally I said, please don't text me anymore. Call me if you want to talk. But it wasn't even something that I was involved in. But people tend to get a little caught up. Now, why am I saying so fervently about texting? Well, about 20 years ago, I sent a text to a family member about another family member. It was a joke, but it was sarcastic. And there was no tone. There was no context. It was just some words. And that family member sent it to 35 of my family members. So all of a sudden, I had all this fallout for something that I didn't mean because it was taken out of context. So in text for me, it's either going to be yes, no, here's a phone number, I'll call you later. So be careful with texts. Also, patient information. It's not HIPAA compliant. And if I get a text, how do I know I have to respond to it? Because I get 20, 30 texts a day. I would much prefer to get email about patient information that is HIPAA compliant. Okay, that's encrypted. Because when I get an email, I'll review that at the end of my day. So let's take it back now to emails. We've covered phone. Talked about text, now let's talk about emails. I do like emails for communication, but it's not immediate. So for emails, what I'll do is I will give my email to all my patients. If they have any questions, send me an email. Then at my leisure, usually by the end of the day, I'll look at the email and I can respond to them. So I have a protocol in my life that I clean up all my emails by the end of the week. Completely cleared. I know I've seen some phones, 4,500 emails, 4,200 emails. I go, what do you do? Because, well, I haven't really gotten through all those. I clean up my emails on a daily basis, if I can. I can't always because I get close to 200 a day. But I sort of, if I can't clear them today, I'll take those emails and I'll put them till tomorrow. And say, these I'm going to take care of tomorrow. And then I'll put another block maybe the day after. So I put a time stamp for all my emails of time to get back. I will review them at the end of the day. Some of you may have a secretary or you may have or an aide or an executive assistant to look at some of your emails to do that. That's great. But since I get so many personal emails right now, I still do it myself. I'd love it to be able to give my emails to somebody else, but I haven't gotten to that phase in my life. One of my mentors, Dan Sullivan, doesn't have a telephone, doesn't email, doesn't text. So he has people take care of everything for him. It sort of frees his brain up to do a lot of thinking. So what do I do when a patient calls or someone calls the office I can't take the phone? I've empowered my staff to give everybody my cell number and my email. So if you call the office and I'm with the patient, they go, I'm sorry, Dr. Sonic's with the patient. Here's his email. You can email him your question, mike@sonicdmd.com, or you can send him a text or a phone call at the end of the day, 203-209-7029. What do I do when a doctor calls me and wants to speak with me, but I'm with the patient? We give the doctor my contact information. 90% of the time, though, what the doctors will say to me is, no, have them call me back. Well, that is a recipe for disaster. When do I call them back? Do I call them at the office? Do I call them at the end of the day? They're not making it easy. So what is important is to make it easy to communicate. Develop a system for your life, for your practice, to make it easy. Unfortunately, we're no longer in a 9-to-5 world anymore. I do very few of my phone calls or emails between 9 and 5. Most of it's done in the evening when I'm out with patients. Now, I'm off a couple of days a week, and during those days, I have one day that I specifically devote to clearing up all my emails and getting all my communication, done. But that just creates a lot more. I mean, yesterday was Labor Day, and I did a bunch of emails for things that I'm doing, other projects. And I email a lot of busy people. And they're emailing me back at 11 o'clock, 12 o'clock at night. And that's what you find. If you want to get something done, talk to somebody who's very busy. They are going to get back to you immediately. Well, there's my rant and bliff on the phone and text and emails. I mean, I got a lot more to say about this. We all have our own personal styles. But if you really want to get me, send me an email and send me your phone number and tell me a good time to call you back. I'll try to get you back at that time. I try not to schedule all my phone calls, otherwise I'd have no time for a life, but I will get back to you. I promise that. I think it's very important to get back to everybody, and if you can't get back to them, say, I'm sorry, I can't get back to you, or I'm sorry, maybe I'll direct you over there. Make sure that you have a system for all communication. And I find that the most successful people are the ones that communicate the best. And I've called a lot of very successful people, emailed them. I'm always blown away that these people who I don't even know send me back an email, saying, hey, I'm sorry, I'd love to be able to help you, but I'm so busy and overscheduled that I can't do that right now. That's clear, direct communication. One thing I don't like, and we'll talk about this in a future blog, is ambiguity. Ambiguity is more stressful than someone coming at you saying, no, I'm not going to do this, or someone saying yes. The ambiguous stuff sort of keeps you there. And there's a lot of ambiguity with the telephone. Well, next week we're going to talk about something else, the patient letter. So I hope to see you next week on our blog or some point in the future. Have a great day. And remember, always be the gift.